I wanted to get started here. So just getting everything set up. Good morning. All right, so you should be able to see me and my slides right now. I keep this audience view up kind of on the side of my screen. If you see me glancing over, I always like to make sure that the audience can see what I'm seeing. So always a good start. Many of you may be familiar with GoToWebinar, but just in case, just a quick reminder, if you do have questions at all, type that into the questions box. So you should see that on your GoToWebinar interface. And I will get to as many as I can. We had over 150 people registered for this. So certainly not necessarily going to be able to address or answer every single question or comment that comes through the questions box, but I'll do what I can. The way that the questions are set up is that I see those coming through, but other people do not. GoToWebinar just kind of defaults to that anonymity. And for any questions or comments that I do get to, I'm not going to say who asked or commented that. I'm just going to say, one of the audience members asked or shared. There are 2 live poll questions that I'm going to do. Those are optional, but they are anonymous. No one will know who answered the poll, let alone how they answered it. So of course, it's always more interesting the more people who participate in the poll, so we can kind of get some aggregate data from our audience today. But I will let you know when we are going to do those poll questions. They're pretty self-explanatory. You'll see a pop-up on the screen. Under the handout section on your GoToWebinar interface, you'll see 2 attachments. One is a PDF of the slide deck. The other one is the tech support help handout. So if for any reason you're having any technical issues, that is the best thing to download and go through that troubleshooting. So wanted to make sure that folks knew where to find the handouts and how to access those. Okay, let's see if so a couple other things in terms of the CEUs. We will send out a follow-up email to anyone who watched this live, going over, the next steps in terms of CEU credit. That will include just a quick quiz through our provider portal, but all the instructions will be in there. So we'll follow up with folks on that. For anyone who wanted to watch this later on, it will be on our website, posted probably in the next few days, maybe next week. But we will make sure that we follow up with everyone that was in the live audience today with information about CEUs. Also, if you are on our panel, welcome. You're, I'm sure, very familiar with Canopy. If you're not, also welcome. So we are an employee assistance program, and really enjoy being able to offer some of these resources to providers, as well as all the resources we provide to our clients that we work with. I had a question come through asking if folks are required to be on camera. Not at all. So the way that GoToWebinar actually functions is, audience members can't see each other, so you do not need to be on camera for the training. So I can't see people on camera, and we can't see each other other than seeing me. So, but totally good question. Glad that you asked. And again, if you see me glancing over, I'm keeping an eye on those questions. There will be time at the end for some questions and comments, but I would much rather, just answer or comment as we go through, so we can, kind of have this be as conversational as possible. Next year, we're going to kind of probably move away from GoToWebinar because of the reduced interactivity of it. As fun as it is to kind of be in sort of podcast mode for me, kind of speaking to a void. But we want to make this more interactive on both ends. So we are going to, and someone asked about my information. We will definitely get there. Wanted to make sure that we were going over all the housekeeping stuff. So we'll probably move into potentially Zoom or Teams next year for additional trainings. So someone also asked, but this of course is part of the presentation. So my name's Caitlin. That would have been also on that initial registration page that people would have been given when they registered. So I've been with Canopy since 2014. I started as a full-time clinician with Canopy. I'm now the training director. So I do have a clinical background. I worked in both mental health and drug and alcohol treatment prior to working at Canopy. I worked both in Philadelphia and in Portland. My background is in trauma psychology. I'm also a certified alcohol and drug counselor, certified death doula, integrative Reiki practitioner. A lot of this is around that holistic approach. So although I don't do direct client work anymore, I have done direct client work prior to Canopy and as an employee of Canopy before moving into the training side. So wanted to provide that information to individuals in terms of kind of this presentation and my background. Okay, and we have almost 100 people here so far, so that's great. And for folks, I try to avoid too much kind of repetitive information, but I know sometimes people are coming from other meetings. So if you joined more recently, the entire slide deck, you can download this under the handouts, and there'll be a follow-up email about the CEU after the webinar ends. Okay, so when we are talking about neurodiversity, a couple things I wanted to specify. So number one, I am not here to read slides word for word. Everyone else can see my slides, so wanted to be mindful of that. The other thing is that, and I know this was encompassed in the description, but I really wanted to be thoughtful in terms of my approach, is that this webinar and training is not about how to diagnose individuals. This is really around supporting folks in a clinical setting. It's not about like diagnostics. So just wanted to differentiate that, but wanted to have a communal understanding here in terms of the training of what I'm talking about, what we're talking about when we're describing neurodiversity, neurodivergent, neurotypical. We may hear these words and not quite sure what they mean. So I wanted to provide some resources here before we get into really the remainder of the training is what can we do as clinicians to support our neurodivergent clients. But sometimes folks will ask, like, what are some of the diagnoses that fall under neurodivergent, which I have some examples here on the slide, and kind of understanding what that looks like. We'll talk a lot about kind of the, ableism, this concept of, which is why it's in quotes, normal. As clinicians, we are all, coming with our own unconscious biases, and that may impact how we assess folks, how we treat the treatment plan, the interactions, the assumptions we make, all of that. So wanted to kind of provide some context around, what we're talking about as we move into what we can do. If you do have questions, comments, also if you have resources, type those into the questions box. I do have a few resources at the end on one of the last slides, but a lot of times in these trainings, clinicians will say, hey, this is a organization that I use, or this is an assessment tool that I use. And feel free to put that into the questions box. I'll share as many of those as I can, just in real time as I see those coming through. So I wanted to kind of an overview of clinician considerations for clinicians. We're going to go into much more detail around some of these, but being aware of neurodiversity, how does that impact how an individual navigates the world? And of course, also how the world treats individuals in general, but sort of having this ability to kind of, again, understand context. So for some, and every single individual is different. And I think, as clinicians, we know that. So regardless of diagnosis, it still is going to be that each specific individual is unique. But thinking about neurodiversity, in some cases that may, impact potential social interaction, social cues. As clinicians, as humans, we may be very used to how we communicate things, whether that is informed consent policies or just, scheduling, if it's logistical, if it's clinical, thinking about how we are communicating that information. And is it, bringing into context potentially neurodivergent processing and how that might be different for different people. Potentially sensory sensitivities. I'm going to go into more detail around some accommodations to consider for that, both for stimming, we'll talk more about that later, but also just the environment we're providing for individuals. a lot of times we may not even consider that something might be impacting someone's sensory input. Like it may not be the case for us, but it is for someone else. Thinking about kind of that highly focused attention on specific things. So if we are providing psychoeducation, if we are providing input in session, or how we are communicating with folks, again, also how we're communicating logistical information, thinking about how that shows up in the communication dynamic. That potential literal interpretation of language can sometimes, just taking that into account. Being aware of that potential busy environments. So if it is a in-person clinical setting, what is the waiting area like? What kind of is it in a building with a bunch of other offices? What type of environment is that? How might that impact someone? Sensory sensitivities, anxiety, and so navigating that and strategizing around how to make that more comfortable for someone, so they can be more comfortable and engaged in the treatment process. Again, also being aware of our own unconscious biases. We'll talk more about that in a little bit. That, of course, is not just around neurodiversity. That's in general, but I think it's always that reminder as clinicians, we can always pay more attention to those potential biases, assumptions, our own version of normal, that we can be unintentionally projecting. All right, so some of you may be familiar with the term masking, but I wanted to make sure that there was a space to define that. So again, this is many members. I am not here to overgeneralize or say that this is, one experience for every person. Of course, I don't ever want to do that. But many members of the neurodivergent community will often say that they feel like they have to mask or essentially hide those neurodiverse behaviors, status in order to be accepted in kind of, the normal society. So that can, of course, create a lot of anxiety, stress. It's a lot of work on that individual, as we know, to kind of be maintaining this mask, and that authenticity does not feel safe to be authentic. And so having to manage that, a lot of times we talk to clients who are struggling with that in the workplace and or outside of work. And so thinking about the clinical setting, making sure that we are creating a space that an individual doesn't need to do that. And then also, again, on top of that, talking about and normalizing that real experience for folks out in the world. So kind of understanding what that means and what that looks like. So I want to do the first live poll question because it kind of takes us into this next section. So for those of you who've joined a little bit later, the poll questions are completely anonymous. No one is going to know if you answered it, let alone how you answered it. So I am going to launch this first poll. You should see that on the screen, and you can answer that. Again, it is anonymous, it's optional. Obviously, you don't have to participate, but I love to get participation because we can get more interesting statistics that way. All of us, are familiar with statistics in the world of psychology and counseling. So I'm going to give it maybe another minute here. We have some more people still voting. So really asking, I'm currently practicing neurodivergent affirming care. So yes, no, or unsure. We have about 3/4 of you have voted. I'll probably give it about 30 more seconds just in case anyone else wants to vote. Okay, let's see, we're probably pretty close here. And then we will, okay, I think we've probably gotten the amount of people voting who are going to. So there's about 100 of you here and 75% of you voted. So I'm going to close out that poll and I'm going to share the results. Don't worry, this is not just for me to look at the results. We can all look at it together. Okay, so we are looking at half saying, just about half saying yes, and then some saying no, and then almost, a third unsure. So I always think it's really interesting, we come into these trainings and I just always really appreciate kind of getting some live polls around where people are at. So I wanted to do that poll before we even got into what that term means. So let's get into that. And thank you so much for all of you who participated in that poll. All right, so what are we talking about? We are talking about neurodivergent affirming care. And I shortened it here just because it's a long thing to type. So neurodivergent affirming care. So really what this is a model that's moving away from that kind of medical model mentality. So instead of the care being, how can we help you, be more in the quote unquote normal category? So pathologizing those behaviors, trying to, have that treatment plan be around changing those behaviors to conform, essentially. So neurodivergent affirming care is not that. So going, more moving to that identity model. So it's there supporting that idea that neurodiversity, again, is not something to be changed or cured. And this really is a major shift. And I think part of this too is that as clinicians, we may have someone come in and say, I have to change these behaviors, in order to fit in, and I'm experiencing like just exhaustion of masking. And so really unpacking some of that. And part of this, which we'll talk about too, is really learning from the client. They are the expert on their unique experiences, on what their goals are. So it's finding that balance of some of that psychoeducation around, oftentimes we can be, the medical model, and maybe they have worked with previous clinicians who have not been working within that affirming care mentality and have been trying to kind of teach them to behave differently in order to quote unquote fit in. That in itself can be very traumatic and upsetting. So having to kind of unlearn what those goals might be or what those messages were potentially in previous clinical relationships. So some of that psychoed around what your goal is in terms of affirming someone and meeting where they're at and really focusing on that identity model and creating space to talk to that individual around questions they may have, goals, and kind of what that looks like in terms of the therapeutic alliance and treatment plan. So always respecting a client's self-identity, their chosen language. Really, again, if there's anything kind of as a main takeaway here is like how to move away from that neurodivergence being a problem to be fixed. And there's just so much kind of ableism, societal messaging that is saying exactly that. So unpacking that and kind of untangling that in that clinical space creates that psychological safety and moves away from, this is something that has to be fixed. So it's also really engaging with that curiosity and openness around how, because intersectionality, there are so many different aspects of what makes us unique, our different demographics we fall into, and how those demographics interact is going to very directly impact our lives. So having that open conversation around it and seeing this from a more intersectional, holistic perspective, rather than here's this behavior that isn't normal and we have to fix it, right? So that is kind of the overview of what we talk about with neurodivergent affirming care. So hopefully for folks who had answered that unsure, this can help kind of get a framework for what that looks like in terms of working with individuals in a clinical setting. Okay, I was also going to check what my other poll question is. Okay, I see it. All right. So making sure that we are clearly communicating. Again, some of the ways we communicate, we may think that it's clear, but making sure that it's like very clear in terms of like what, why, when. That can also be documentation. So verbal communication, written communication, making it very, very clear. Also thinking about, again, what that waiting room looks like if it's an in-person setting. I think the other piece too that will often come up is that in some cases we may have, whether we work or only have a virtual clinical setting or in person or both, many clinicians may have a support team, a non-clinical support team as part of that business, and making sure they are also trained, because anyone interacting with a client needs to also be trained on creating psychological safety, educating themselves on creating a safe, welcoming environment for folks. And all of us have implicit biases or a certain level of training around that. And I think sometimes as clinicians, we can sort of get into this vacuum of only having, you know, like the CEUs for clinicians, the training for clinicians. And this is talked about a lot at larger settings too, whether it's at hospitals, like any type of environment where there are, you know, specific helping professionals in the sense of like medical professionals, mental health. But what about the non-clinical professionals who are also working with the same population? Is everyone needs to be trained in that trauma-informed care. So that can be, you know, kind of a measurable thing to determine how to make sure that your whole team is trained as well. Sending appointment reminders, that can be another measurable thing. So if you don't have that set up, setting up that appointment reminders for all clients, that can sometimes help in terms of just making sure people are getting clear, consistent information and assistance with some tracking. Again, I would say that can be helpful for everyone. So just trying to think of some kind of measurable things to try. All right, so I had mentioned stimming earlier, in case anyone wasn't quite sure what that was. So those can be repetitive movements, sounds, and or actions that an individual will engage in to help regulate themselves and manage emotions, cope with stress. That can look very different for different people. And in some case, there could be stimming actions that, like for some folks, they identify as like potential pain stimming. So like picking at their nails or something. So it's thinking, all right, let's try to find a safer way to stim during those times. But I think understanding what stimming is really, really important. And I will provide, you know, kind of more information and resources, but I may be getting ahead of myself. But in a waiting room environment, having, there are a multitude of stimming items and toys that are very cheap. And so a lot of times offices and waiting rooms will have a space for those for folks. And so that is another way to create an inclusive space. So a waiting room having those identifies that inclusivity, that you recognize that many folks may have a need for those, and you offer those as available both in your office and in the waiting room. If they're virtual sessions, it could be that a client is stimming during sessions. So making sure that they're able to do that in a way that helps and kind of talking about how that can be supportive. So I think it's really important to know what that is. And again, this all kind of comes down to acknowledging that specific unique traits are welcomed and accepted in session. We're not trying to conform them to an ableist society, and we're also not trying to conform them to this kind of narrow idea of what you know, interacting in session looks like. So how can we meet them where they're at? Okay. See here, I'm going to launch our second poll question. So I'm going to put this up here. Everyone knows how the poll questions work now. So we will see how this breaks down. And there are websites specific to stimming where you can buy stimming toys. Some are for certain age groups. There are some websites that are just, you know, all ages. If you go on Amazon and you search stimming toys, you'll literally find a million. So there's lots of places that you can get those, and most of them are incredibly cheap. Okay, we are going to give this about 10 more seconds, and then I'll post the results here. All right. Let's see. I had a great question just come through asking if stimming items are the same as fidgets. Very similar. So yes, if you look up fidget toys, it's going to be incredibly kind of a similar combination. So yeah, and many people are familiar with different fidget toys. So I would say it's kind of like a Venn diagram of sorts in terms of stimming and fidget toys. But yes, so as you can see here, kind of the breakdown, almost 50-50. So I think it's always good to just think, all right, how could I maybe add some or update some of what's in my office spaces? Let's see. Yeah, okay, so the difference between fidget toys and stimming. So I'll give one example. So a fidget toy may be, I don't know if anyone, I feel like now this is gonna, I'm trying to remember when they started being really popular, like those fidget spinners, if anyone's seen those. And people use them maybe just as like, you know, if they were like, it's easier to focus on that than it's like hard to sit still. And adults, adolescents, children would use them. A stimming item that's a little bit different, but again is kind of all within the like coping skill device, if you will, Venn diagram is, I think it, and I want to be mindful here, I'm not like advertising for any company, but there, I believe it's called like Ouchies, and it's a stimming tool that looks kind of just like a little sort of cylindrical tube that's the outside's kind of pokey, and for folks who would pain stim, so again, kind of like I mentioned, like maybe picking at their nails, something that's not particularly good for us in terms of just like, you know, if we're picking at our skin or nails. So instead of that, but because that like little tiny bit of pain is part of that stimming and that grounding that is working for that individual, is it's sort of like this like harm reduction mentality. So instead of picking at one's nails or pain stimming in a way that is impacting our body, is holding one of these ouchies that can like have a little bit of that pain stimming without injuring us in any way. So that's a little bit different than like a fidget toy that's just maybe someone's using to help them stay focused. But again, it is really a Venn diagram, because all of this is kind of helping our brain and body, whether it's in grounding techniques, focus, those types of things. But that would be one example of a difference in terms of a stimming tool versus a fidget toy. But if you look up stimming toys and fidget toys, again, if you're say on Amazon or some website, you're going to see a lot of crossover with those. So it's good to have a range. Let's see here. Yeah, someone was talking about how they work in telehealth, but they encourage fidget toys or whatever the person needs to feel more comfortable in their home. Absolutely. Or maybe someone is like, I would feel way more comfortable having these sessions like laying down with a blanket around me, you know, and we're used to being like, oh, we're sitting here and we're looking at each other, but thinking, you know, what would be most physically comfortable, like what space, how to be in that space. I was doing an in-person training once at a team meeting at an organization, and there was someone at the team meeting and they just had a stuffed animal with them, you know, so it's not distracting to other people, doesn't make additional noise, and that was something that helped them in that moment. Yeah, I'm looking also just, I love all these resources and these comments. It's like, again, making this as interactive as possible, so I'm not just talking at everyone the whole time. Okay, yeah, this is wonderful. So one individual said that kind of with their experience, rather than potentially making a client kind of more dependent on you, I'm just reading this comment, they're saying that they find working with clients who might forget appointments to kind of reduce that shame and find ways to aid their memory for more independence rather than just sending appointment reminders. And I really appreciate that. So it's thinking about, you know, having that conversation. So destigmatizing that, meeting that person where they're at in terms of what would be helpful to support them. And as this individual is saying, kind of really make sure to also support that individual, that client in being able to, you know, engage in independence, engage in practices that work for them. So I really appreciate that feedback. I think that's a great idea. Okay, let's see here if there's anything else. The questions box I have on here sometimes covers some of my slides. So I'm like, did I get to everything? Great question. So the way that GoToWebinar works, I can see the questions and comments, but other people cannot. For those of you who may have joined a little bit later, this is part of the reason that Canopy, like, we're going to move away from GoToWebinar because I would love for everyone, you know, kind of like, if we'll probably switch to Zoom, that way everyone can see everybody's comments in real time. So anything kind of starting next year, we're going to move away from this model where it's a little bit more, challenging to interact with fellow audience members. But that was a long answer to a short question. No, audience members can't see other people's comments. And I will absolutely do everything I can to comment on or address anything that's coming up in the questions. So I really do want to make sure that it is as engaging as possible, even though audience members, are kind of disconnected. All right, so some additional potential accommodations, fragrance-free environments. So just being aware, again, a lot of times, whether we are new or have been a clinician for many years, we have our own habits and have our own, needs in terms of our environment too. So, finding a balance. So being aware of, what that office space looks like. So, being aware of potential fragrances that could be detrimental to folks or triggering for folks. In terms of any type of written communication with clients, always recommend using dyslexia-friendly fonts. I have examples here on the slide. So that is, I, again, really am trying to think like, what can I do right away as a clinician to even small changes? What is something that I can do differently, more logistically, like changing fonts on paperwork and written communication. And then that other piece of, what would it look like? And I know I'm going into kind of like the motivational interviewing, but if I was suddenly being more, inclusive and affirming in terms of neurodivergent care for my clinical practice, what would that look like? So, for each of us to take that time and do that inventory. Some, backup plans. So if there was something where you were out sick or had to reschedule something, or there was, some last minute change, having a conversation around that and potentially having a plan in place for ways to reduce stress for those types of last minute changes that could be potentially a stressor for a client. We talked about having those fidget and stimming items available in waiting room and office. And everyone has a different processing time and how they process information. For some folks who are neurodivergent, it may take a different amount of time to process. Maybe you're in session and you're providing feedback or asking a question, really giving more time and space for that individual to process that and respond. And I think, as clinicians, we're hopefully doing this with every client, just communication style, processing style, but I think it's just this reminder and a good reminder to kind of fall back on kind of stepping away from any kind of default of how we communicate. It can also be just our communication style. I know for myself, and I'm naming this in real time, I can talk fast. So, and I'll be like, oh, that is happening right now. So for us as well, just like how we tend to naturally communicate and how that may be potentially benefiting or more challenging for some clients and adjusting to that. All right, so some other additional considerations in terms of creating psychological safety. I think that, so adjusting to clients' needs, that's a lot of what we've already been talking about. So what are some other things underneath that? This is in general, is to really be mindful of how we are, respecting our and our clients' time, but really, really being mindful of not being late to session, whether that's in person or virtual sessions. Avoid making last minute changes. There may be some clients where there is a structure or rapport where it's like, hey, any chance you can, move the session today to 3 instead of 2? And there's some clients that are just like, maybe more comfortable with something like a last minute decision like that. Others may not be. So really finding a way to be thoughtful of that, that reliability, that consistency is really important. Any questions? So there was a question about the CEU credits. In terms of what this specific course counts towards, please consult with your licensing agency in terms of that. Oh, this is really interesting too. So someone's sharing how they provide psychoed to caregivers. which is to allow their care to intake the information and put it into their language. They're not ignoring the person they're processing. Yeah, so I think really this is that holistic approach. And I'll kind of get at the very bottom here talking about occupational therapists, how we can approach this more holistically in terms of treatment planning. So incorporating clients' interests and passions. So hobbies, interests, passions, something that they enjoy. It's such, I mean, of course, this is for, you know, clinical intervention in general, but I think particularly with this population, finding a way to really tap into that, learn about those specific interests and passions, how to potentially incorporate those into coping skills, coping strategies, confidence, and really spending time to engage in those and learn about those, which can really help with that psychoed, engagement, learning. Maybe someone really, really loves knitting or something, or crocheting. It's like, have them bring that to session and they can like knit as they're talking. So ask about that, learn about that. So really like bringing that in to that client relationship. And this is so much about celebrating that identity, is how in every aspect of the space I'm creating and the clinical intervention I'm utilizing, are we celebrating this versus this needs to change? And I want to be mindful, because a client may say, here's a certain behavior, here's a certain pattern that I would love to kind of consider changing. And this is where we meet them where they're at. And it's also that ability to always see things through the lens of, where are we balancing potentially like internalized ableism versus a client's goal that they are bringing from their own authentic self of wanting to change, and being able to have a dialogue around that. And this is exactly what this kind of point here is making, is being able to name and discuss that societal ableism, how we might be potentially internalizing that, and how we think about ourselves, our goals, what we feel like we need to fix about ourselves. You know, where is that coming from? Where is that messaging coming from? And how does that impact how we feel about ourselves, what our goals are, what we want to use this therapeutic setting for. So there's also being able to track on sensory safety measures. So it could also be just being aware of, you know, when and how do you notice stimming most often? What are some of those trigger points? Like really bringing that into that assessment and potential treatment plan. Those mindfulness practices. For some individuals, collaborating with an OT, if that would be helpful. I'm just going to take a moment here to see some of the comments and questions coming through, because I'm getting a lot of them coming through now. So that is good. Like I said, I may not be able to actually answer or get to every single one, but I'll do what I can. Let's see here. Yeah, so someone's talking about they do psychoed around executive functioning versus an assessment to determine strengths and weaknesses. Let's see here. That's a pretty effective design for them. So talking about developing strategies for a client who struggles to initiate tasks but has a strength in prioritizing and planning and knowing how to break down the task they need to initiate. Yep. Yeah, there are a lot of different, if you search sensory self-tracking checklists, there are a lot of different ones. It's going to really depend on like age range. And I think it's also making sure to determine kind of what's within and without our scope. And that's why sometimes bringing in an OT can help with that. Someone else is sharing how they have a client who has a therapy rabbit. And let's see here. Yeah, exactly. So that was really helpful for that individual. So finding ways to really, again, meet people where they're at, support their process of what they need to feel comfortable in session, and really supporting folks and meeting them where they're at. So all of these recommendations are wonderful and great to read about. Okay, so I put this up here. I really wanted to, again, give credit where credit is due. So as you can see, that is credited this individual here. I have the link to this website on the resources page as well. I found the website to be extremely beneficial. I think it is very clearly laid out has a lot of like measurability around like, but what do we do as clinicians? And so I thought this was a really interesting kind of infographic, but the website, it has tons of other resources as well for clinicians. So thinking about, okay, so what's next? So what are potentially these common therapy goals? And this specifically is around adults, but wanted to kind of share some of these. So we talked already about, giving voice to and really talking about that potential internalized ableism, how that's impacting someone's experiences, their goals, how they feel about themselves, that narrative essentially. There's also, how to integrate our identity. And we talked about that with intersectionality. So how does that neurodivergence potentially intersect with other identities that we have, our relationships, how to have that be something that's integrated and we are safe to be our authentic selves. That goes right into that unmasking. So what would that look like? And having that conversation of doing that in a way that is, if someone is very used to experiencing kind of having to always be masking, like where to start practicing that unmasking, how to do that in an approach that feels safe and comfortable, and having that be part of that conversation. What does that authentic self look like, feel like? What would the authentic unmasked version of you be doing in this environment? And how to also really work towards finding inclusive, welcoming social systems. So navigating that. We talked a little bit about that sensory and nervous system care. So either more effective or safer stimming and fidget tools, really integrating those in, finding a way of, what's working and what's not, and also noticing what potential sensory triggers are coming up. So that kind of goes back to, if there's like any type of like within the 5 senses, what might be triggers? What are some ways to talk about what to do if those come up out in the world that are potentially unavoidable in some cases? Someone had asked about the slide deck. Yes, you can download this entire slide deck under the handouts. So if you click that arrow next to handouts on GoToWebinar, you'll see a PDF version of this whole slide deck that you can download. Okay, let's see here. Just wanted to look and see if I can. Yeah, and someone's sharing about, making that psychologically safe space in session so a client doesn't feel like they need to be masking in session. And, so much of that is that openness, that welcoming, accepting, non-judgmental environment. And I think that is where, this individual's like, are there kind of more measurable examples of how to do that? Some of this is, having stimming and fidget items in office, in the waiting room, telling someone, I know everyone may be more comfortable in a different way that they are in this environment, or if you're more comfortable, laying down during the session versus like if it's virtual and they would rather be sitting in a different space, like really naming that each individual may want that space to feel different for them. And just like a lot of those accommodations that I shared in earlier slides that are, identifying some of those very specific changes or updates to whether it's the font, whether it is, this not having any, like certain sensory things like, I'm not going to have certain candles or plugins in the office to respect people's potential sensory preferences. So all of those things that we're really naming in terms of that inclusivity. And with, kind of on this slide, sort of walking through the rest of this is really, meeting someone where they're at in terms of addressing that trauma, that chronic invalidation, that internalized and that very real experience of how our society treats folks who don't fall within that norm, and how chronically traumatizing that can be. And how that affects us physically, emotionally, and mentally. And I think, as we know as clinicians, so much of that safety comes from genuine validation of experience. And so it is, so much of that is doing that and really naming that. I think especially if someone is had experience of chronic invalidation, it can be very difficult to feel safe to be honest about that experience. Also, as we know, the mental health and medical community is not necessarily always psychologically safe for everyone. So their past experiences with providers may have been not a psychologically safe space. So, that validation around all of that. And how, more self-advocacy, empowerment, what that looks like for each individual, and really having these be some cornerstones to think about in terms of treatment planning. I'm getting more questions about accessing the slide deck. So you can get that whole slide deck under the handouts in GoToWebinar. And if you just click the little arrow next to handouts, you'll see that. So a couple of resources here. I know I just mentioned, so that Neurodivergent Insights, that's pretty kind of self-explanatory hyperlink there. So that has, I just found that to be, again, that's where this infographic came from, but it has like an entire list of resources in terms of all the levels of neurodivergent affirming care. So like, what does that look like? How is that defined? How does that impact treatment planning? How does that impact how we create a safe space for folks? So I found that to be a very sort of rich resource. And then this is more of like a client, direct client resource. So the neurodiversitynetwork.net, and that has kind of a quick overview of what that is. So, how can we, I just wanted to have a resource for clients and a resource for clinicians on there. Okay, let's see here. I wanted to see, I'm trying to avoid everyone just watching me read a bunch of comments. So I've been doing my best to read in real time without long pauses or everyone's watching me read. I think that I'm just trying to make sure I didn't miss anything so far in terms of comments that were coming through, because there have been so many wonderful comments, resources that people have shared, questions. One thing that I think is interesting, kind of talking to some, and I'll just be kind of candid here, some clinicians who have clients who may come to them and be asking for like to sign paperwork for like an emotional support animal. First of all, I'm like so supportive of how much animals help individuals, and the individual who shared about the client having a rabbit is so wonderful. I think that one of the things I've noticed from the clinical side is in the desire to, and very understandable desire to support clients and their needs. It's like, yes, absolutely, I will sign off on that. I think it's really important to be mindful of the animal safety and needs too. And so being aware that depending on what someone is wanting a signature on or being signed off on, I'm just very much an advocate of making sure that the individual and the animal are able to meet the requirements of what we're signing off. So just to be thoughtful of that, and I think even over time, thankfully, there's been more regulations and rules around animal-assisted therapy, emotional support animals, et cetera. But I think sometimes, because I have a background in animal training as well, I think sometimes clinicians may not have as much experience with animals or animal training, and there can be an animal that's very supportive to an individual, but is not going to be comfortable being out in an environment around other people, and that may not be safe for the animal, other people's animals, or other individuals. So I'm just very much a proponent of, if you have someone coming to you with questions about emotional support animals, of any paperwork they want you to sign off on, please, please, please make sure that you are considering the well-being and safety of the animal and the individual. And so that's my kind of quick overview on that, because I see a lot of those requests come through, and I have from a lot of interactions and conversations with clinicians. They're like, oh yeah, they would feel more comfortable if they could bring their dog everywhere they go. I'm like, but is the dog capable and trained to do that safely and effectively? And they need to be trained. So that is my very kind of side note on that I think is really important, that I don't think enough clinicians consider when they are having clients request any type of animal assisted support. Let's see here. Let me see. So someone was commenting too, so I'm just kind of reading the comments here as they come through. One of the things I'm reading this comment. One of the things I really struggle with is the adverse effects of masking or not being able to engage as your true self versus the effects of authenticity. So for example, a ADHD client who wants to share at length about hyper-focused interests, who can realize that others lose interest and it impacts their ability to socialize and maintain friendships. Yeah, I think this is so interesting. It's like how we can hear about people's experience and how folks can engage in their authentic self and not feel like they are in a space where they have to mask or not be their authentic self, and be around folks who support that and recognize that. And I think, you know, this had kind of come up earlier, but if someone says, hey, I want to, you know, learn how to try doing this differently, I think as we know as therapists and clinicians, it's around that content and process. So if the, you know, process behind it is shame-based, or I have to be more normal to be accepted, then that's something to unpack in terms of what the goal might actually be, or kind of how to move in a direction of more affirming authenticity, versus the process is, you know, this is something for me specifically I would like to work on or try doing differently. That's not coming from there's something wrong with me, kind of shame-based mentality. So I think that ability to unpack that as a therapist, of really kind of falling back on that content and process, and being unique to each individual's needs. Okay. Right. Wonderful. Okay. So if I wasn't able to get to a comment, there were so many that were coming through, so I really, really appreciate everyone's resources. And if you have any questions, so I wanted to kind of jump to, I know we were just going through some Q&A here. So with Canopy, this is our basic information here, our contact info. At the end of this training, you will receive an email with a recording of this. And I know I probably shared this many times, but you can download the slide deck from the handouts. We will also send a follow-up email that has all the information regarding the CEU credit. So just wanted to make sure that that was clear. The other thing I hadn't mentioned is that we always send out an optional survey. So not only do we love to hear feedback on the trainings themselves that you attended, but if there are topics that you would like us to offer, that's another place. If you have, you know, feedback, suggestions, any of that, we love to receive that information. Okay, I want to be mindful of people's times and schedules, so I think we will wrap up. I am going to wrap up for today. I really appreciate everyone attending and participating. Contact us if you have questions, but you should be receiving some follow-up emails here shortly, and we will go from there. But thanks for coming, and have a good rest of your day.